electrocardiogram. PQRST. So when we see the Q, oh, I'm sorry, when we see the P, what part of the heart is being represented by P? Atria, contraction, depolarization. When we see the QRS, what is being represented on an EKG? Ventricles contraction or depolarization. Let's get used to depolarization, contraction. Because they tell you contraction means what? Depolarization. And repolarization means what? Relaxation.
I'm sorry, Professor. Like, what time we're leaving? Because I'm getting picked up, so I want to know.
Somebody's going to pick you up?
Yeah.
Okay. 9, after 9 we're leaving.
9? Okay, thank you.
Okay, moving on. He said right here, remember we mentioned this already, but here you have the supporting documentation, if you will. Negative deflection, remember deflection waves means the same. Now, negative deflection are the ones that are under the baseline or isoelectric line. So remember, we said the P wave is positive or negative? Positive, because it's above the baseline or isoelectric line. So now, it said right here, the Q wave. The Q wave is negative. Why is negative? If we can see it, because remember I mentioned that sometimes it's not visible on an EKG. If it's not visible, excellent. Because when we see the Q wave and it is too large, too long, too deep, that means that the patient is having a problem. So everything has their own measurements. Remember, bless you, if you have too much sugar, are you okay? Oh, you have a reserve right there. No, that's not good. If you have low sugar, is that okay? It's not okay either. We have to be balanced. Not too much, not less than normal. We always have ranges of what's considered normal. So a Q that is too long, later on we're going to see what is too long, too deep Q. But if you don't see it, that's fine. But if appears on an EKG, has to be negative. That is the way it works. R. The R is positive or negative on a normal EKG. Has to be positive because it goes above the baseline or isoelectric line. And on an EKG, we can have many QRS, PQRS complexes because each heartbeat we have between 60 to 100 beats per minute in a normal person, right? But you can have 350 beats per minute in someone who's having hypertension, someone who's having this arrhythmia that we're going to talk about later on, someone whose heart is not working normally, and this is the people that collapses, this is the people that sometimes dies or heart attack because the heart is beating so fast that when it beats so fast, what is the function of the heart? To pump blood. But if it is going too fast, how much blood are you allowing the heart to fill in and to pump? Nothing. So because you don't have blood running, circulating, no oxygen, the brain collapses, all the organs collapses, and you die, of course. So that is basically what it says here. A second R wave is the R prime written. You don't have to know that. So that will be seen when we do an EKG, when we place the leads on the right side of the heart versus the left side. So we're gonna see certain changes, but that's not applicable right now. So the only thing that I want you to remember is if you see a T wave has to be positive in a normal EKG. If you see an S has to be negative on a normal EKG. If you see an R has to be positive on a normal EKG. And a Q negative on a normal EKG. And the T wave has to be positive. And they has to be rounded, like the P wave and the T wave counter-rounded, because if it is pointed, then you have a medical condition. So all those things that we look at when we are evaluating an electrocardiogram, it gives us an indication that something is wrong in certain places or locations of the heart. And that's how the cardiologists know what to address, how to treat it, what tests to order, what surgical procedures to do if it is necessary. Go ahead, Mercedes.
No, I was going to ask if it was chapter 2, but I see it. We're still on chapter 2.
Oh, yeah. See, we have here the S and the QS. So, S wave negative all the time in a normal EKG. So that's basically what it is. Always we're gonna base this using the baseline. Remember, the isoelectric line. That's how we know whether it's above or it is below. Let's talk about these electrical impulses. Where are they derived from? There are several cells that we have in our body that do different functions. Remember, we have cells in our body that they are not the same cells. If I have the cells that makes up my nervous system, well, those cells do different functions than the cells that makes up my bones, right? My skin, my hair, my nails, my heart, my digestive system, and all the different systems, because each system has specialized cells that do certain functions. So the heart cells are no exceptions. For that reason, we're going to talk about certain characteristics of the cells that makes up the heart, because they have to have certain characteristics, certain functions. Some of the cells are going to be automatic, and that's called automaticity, meaning they don't have to be triggered by anything, they just happen. This is like, well, not applying for the automatic cars, but in a way, yes, because you don't have to do all these shift changes like I do in my country. You know, I have a car that you have to do the shift, right? The changes, it's manual, mechanical, correct. So otherwise, you just turn it on and you just press the brakes and the gas, and that's it. You move on or you stop. So these cells don't need to be triggered for anything. If they are automatic, they mean whenever they have to, react to become active, they do it without receiving any stimulus from anything. So that's basically what it is. Let's say the pain receptors. In order for the pain receptors to be activated, I have to pinch you, I have to hit you. Other than that, you're not going to activate them. For these automatic cells, it's different. They just senses. Then the chambers have filled in with the blood. Now they know that the valve needs to be open. Then they trigger automatically. So we don't have to manually go and trigger them to do it. So that is automaticity, electrical stimulus, conductivity. one cell is going to send the information, the stimulus, to the next cell. This is like the relay center. Remember, there are certain cells, because they have the same function, they have the same characteristics. When one cell activates, it passes to the next one, to the next one, to the next one, and all of them are going to become active. So that's what is called conductivity. Remember, conductivity is that conduction. One triggers the other one, the other one, the other one, passes the message, passes the message, passes the message to the next one. So that's basically what it is. Excitability. The cells becomes very excited. Excited means hyper. Why? Because they've been stimulated by this electrical stimulus. So when one becomes very excited, the other one also follow that. Think about someone who is screaming, and then the other one started screaming, and the other one started screaming. So everybody kind of join this action, and every single cell will be doing that. Contractility. This comes from the word that contracts. Remember that the muscle of the heart needs to contract. But what makes the heart contract? This. That the cells become excited. The cells, when they come excited, they communicate. The one passes the message to the next one, to the next one, and everybody gets hyper, everybody gets electrified, and then the muscles contract. Now, if you notice, one of the major questions that might come out on your exam, it will be which of the following characteristics of the cells of the heart is considered mechanical. Which one is it? Contraction. Contractions are mechanical. Everything else is not. Just look at this. When we give the patient CPR, are we doing mechanically or are we doing electrically? Mechanically. We are putting our hands on top of the chest of the patient and start squeezing the heart in between the breastbone and the spinal column. That's what we do, just squeeze, because the heart is not contracting. So we are contracting the heart. Can we start the SA node, the AB node, and the Purkinje fibers by pushing hard on the chest? No. It has to be with electrical shocks, remember, because that is the one that is going to activate these batteries. Pushing my car because the battery is died, it's not going to get it started. What is going to get my car started?
Battery.
Of course. Or somebody give me booster, right? It's got to be charged. That's electrical. But manually, I can push your blood. At least the reason what we do CPR is because when I press over the chest of the patient, the heart is not pumping. I'm sending blood to the brain, so the brain can stay alive when the rescue people comes in and save this person, bringing it to the emergency and doing the electrical and whatever else is needed. Is that understood? So in the case, these are questions for exams. In the case that the patient is having a heart attack, what is the procedure, the first aid procedure that we're going to give it to the patient? CPR, excellent. CPR. The patient collapses, right? The patient do not have a pulse. The patient is not breathing. How do we know that? Because we're going to check on the patient. We're going to check for breathing. The chest is not rising and falling. And we tap the patient. We ask the patient, are you okay? Are you okay? And the patient does not respond, doesn't move, doesn't flinch. Then immediately we check the pulse. We check the pulse right here by the side of the wrist, by the thumb side. And we check for how long? At least for 10 seconds. And in 10 seconds, we're going to see if there is a pulse. And if there is no pulse, patient is not breathing, start CPR. What will be the medical term that we use when a patient do not have a pulse? Anybody knows? If you don't have a pulse, what will be the term that you will use to describe no pulse?
Not responding?
No, the word pulse. Give me another word for pulse that is not pulse. That means that pulse for someone who is not, doesn't have a pulse.
Heart beating.
Coding? No, blue code. Blue code is when our patient is in cardiac arrest. We need someone to revive him immediately, otherwise in 8 hours is gone. Color code. Usually it's a color code or blue code. Immediately that patient is in very serious. No. What was that? Yes.
Wow.
Remember, pulseless. Pulse means that you have a pulse. Less, you don't have a pulse. So this is the question for your exam. When would you give CPR to the patient? When the patient is pulseless. Not when the patient is having a chest pain. I can have a chest pain, but I'm breathing. I'm complaining. I'm saying I have a chest pain. I need to see the doctor. I'm gonna collapse. Do I give you CPR to this person? No. You only give CPR to the person when is don't have a pulse, is not breathing. Now, I'm gonna give you CPR to someone else. So the term that we're gonna use to describe someone who doesn't have a pulse is pulseless. Remember, no pulse. Without pulse. So that's not in without pulse. Oh, I was saying in Spanish. So then, yeah, not in a pulse. Because I do these courses in Spanish. And it's funny, right? Because I'm from countries that do speak Spanish, but that's not my first language. It is Portuguese. But I know now more Spanish than Portuguese because I don't use Portuguese at all.
Really?
At all. I go over there and I understand a lot. But some of the words I said, what's this person saying? And I responded in Spanish or English. I said, okay. Or I asked, I said, wait a minute, what's the word that you use for that? But it's fun. So usually this is what I want you to understand, because what they're going to ask you here is which one is mechanical, because everything else is electrical. So for that reason, I walk you through the CPR, because the CPR is contraction, it's mechanical. I'm kind of pumping your blood of your heart with my hands by pressing over your chest. Any questions? Okay, it says right there, automaticity, conductivity, excitability are all electrical characteristics. Contractibility is mechanical. So you know that when the heart contracts, it's because it can be done mechanically. Electrically, everything else. Okay? So don't worry about the electrical one, worry about the the mechanical one, because that's the one that I want you to know. The sinus nodes is the normal pacemaker of the heart. Remember, sometimes we hear about pacemaker, right? Everybody has heard about pacemaker, right? When you watch the movies, TV says, oh, they need a pacemaker. So we always think that pacemaker is the artificial one, the one that we're gonna place on the patient, and oh wait a minute, I'm gonna replace one of the patients. If I'm replacing the patient's pacemaker, it's because the patient has a natural pacemaker. And what is the patient's natural pacemaker? What is called? SA
Sinus.
node, correct. Sinus node. This is the major battery. This is the one that initiates. Remember, the pacemaker, the SA node, the natural pacemaker is the one that initiates the electrical impulses of the heart. This is the main battery. If that is not functioning, then the rest of the things are not functioning. So this is like the transformer right outside on the streets that brings all the cables to the meter, to the electrical meter through your home. But that one is not working. That one is not going to bring no electricity. And these switches out inside here are not going to be working. These outlets are not going to be working because there's no conduction from the main source. So that is basically what happens when the patient has problems with their heart. And when they collapse and have a heart attack, is that all these power sources shut down. We need to restart the powerhouse. And the only way is doing CPR. But while we get the machine to do that, we have to start the mechanical one because we don't want the brain to get damaged. What is the purpose of me reviving you, but you are brain damaged? You're not good. So that's basically what it is. So very important.
Just wait, don't change it yet. Just one.
Cardiac arrest is like a heart attack?
Yes, it's the same. Cardiac arrest, myocardial infarction means the same. Heart attack, all of those are the same.
And dysarrhythmia?
Stroke is brain. The arteries in the brain did not receive enough blood, then whether there is a blood clot.
That's like why they like lose control sometimes when part of their face.
Yes, that's the one that paralyzes one side, where the problem, if it is on the right side of the heart, you paralyze the left side. If it is on the left side, you paralyze the right side. But that side completely will be paralyzed. You will not feel anything right there.
You said myocardial what?
Cardiac arrest, myocardial infarction, heart attack, all means the same.
If you see a dysrhythmia and the EKG, that's like something that like the
Heart attack, cardiac arrest.
No, not necessarily. No. Dysrhythmia just means that the rhythm of the heart is not within the normal parameters. See, your heart should be beating in between 60 to 100 beats per minute. Now you have a dysrhythmia. It means that it's over 100, but it can be 110, 120, 100. But the farther that it gets from normal, the worse situation. But there are different types of dysrhythmia. Because it can happen to the atria, happens to the ventricles, happens to because of the valves, happens because of the blockage of the blood vessels. So all of that comes to, to a decision of what type of dysrhythmia you have. This means that it's not equal. Rhythmia means rhythm, is how your heart paces. So
it went to see a heart murmur, like a first.
well, a heart murmur is it's not that you see it, but there are some indications that you might have a heart murmur, because most of the time you have a heart murmur is because we hear that when we listen to it. Yeah, this is like a lick. We hear like a little, like like you have a hose, right? And a little hole makes to the side and water is coming out through that. Yeah, like escaping from one side. Then we hear that little.
Can I close up between those?
Yeah. That can be fixed. That can be fixed with medications, with injections, or it can be fixed with surgical procedure depending how bad it is. So here again, well, let's talk about the normal inherent rates of each one of these batteries. Remember, we talk about 3 batteries, right? Always think about 3 batteries, 3 sources of electrical charges within the heart. SA node, AB node, and the Purkinje fibers.
Purkinje fibers. Purkinje.
Yeah. So it says right here, sinus node or pacemaker. Remember, we are not talking about the artificial pacemaker. Later on in this class, I will tell you how to recognize when someone has a pacemaker, when you see an electrocardiogram. Well, you will see it as soon as you uncover the patient.
Yeah.
Because you will see a little scar right here, straight up, and a little bulging over there, right? But sometimes you might not even pay attention to that. But then, when you've been asked on an EKG, when you're given the printout, and you've been asking a question, okay, what is this patient, what can you see in this EKG? Well, you're not seeing the patient, you're seeing the recording. How are you gonna know whether it has an EKG, has a pacemaker or not? Then you will notice, because I'm gonna tell you, with which type of, because there are two types of pacemaker. One from the atria, one from the ventricles. Whether the atria is failing or whether the ventricles are failing. So let's talk about these inherent rates. Inherent means it is natural, it's within how they should be pacing themselves. It's not something that we're gonna add to it. No, this is how our heart functions. This is like what you inherit from your family, any traits from them. Usually we look like our parents, right? Either or a combination. So that's what sometimes people say, wow, you look alike, but they're not even relatives. What do you mean you look alike? Oh, but whatever. So this is what we're going to talk here. So the pacemaker, the SA node, what is the inherent rate? 60 to 100 beats per minute, normally speaking. Remember, in order for us to know that it's abnormal, is because it goes beyond 100 or below 60. So we have to have this reference first. This is like when you go to the doctor and they draw blood. How does the doctor knows that you have more sugar than you're supposed to have? How do they know that you have more sodium, more potassium, more calcium, more magnesium, more hormone of this or less hormone of that? How do they know? Because we have ranges of what's considered normal. They are established already, but certain laboratories that they did their studies and scientifically they put it that way. So if we go beyond that, below that, then we have or too much or deficiency of. So here we're going to talk about how normally an adult heart should beat per minute. So normally 60 to 100 beats per minute. Know all this table because it will be asked. I'm going to ask you in my exam. So the only thing that you have to do is go to the page where you have all the information. Read it. Try to kind of make it sense, and then you will come out with the right answer when you take your national exam. If these questions happen, to appear on your exam.
You sent us that today, right?
No.
I'm going to send it.
Well,
The
'cause I
school sent
received
it.
something
Yeah,
today.
yeah. The school sent it, but according to some of my students, they didn't receive all the chapters. It's supposed to be 14 chapters. How many did you find? If you have 15, I give you 100 for the next test.
I'm gonna tell you right now. I'm gonna tell you. Crazy.
So, remember, these are the batteries of our heart. SA node, AB node, and Purkinje fibers. The SA node, because this is the main battery of our heart, the one that initiates the electrical impulses, has to be higher. Because this is the main powerhouse that we have in our heart. So this should be 60 to 100 beats per minute. What about the second battery? It says right here, a backup. These are up batteries, because if this doesn't work, this takes over. But if you notice, it's gonna take over a lower heart rate. This 60 to 100 beats per minute is a lot for our work to function. But if I cut it down 40 to 60, how much do you think your heart can work? Not much. For how long this pace can hold you alive? Not for so long. Because remember, 60 will be the lowest you can get. Now 40, you are already collapsed. You are already in need of assistance, medical assistance. This is not someone who's running around and who's teaching a class or who's taking a class. No, this is someone who already collapsed. And if doesn't receive medical attention, it's gonna move to this, because this is gonna collapse. Now it moves to this.
This one is dead then.
Then right here, this person has 2 hours to live. Here it has 8 hours. 2 hours. You don't come to rescue me, that's it, this person is gone.
So you got 2 on tops.
Yep. So 40 to 60. This one is 20 to 40. My goodness, 20 to 40, that is completely below what is expected. That is supposed to be 60. So it's very, very low. So once again, this person will not have too much time to live. That's why when someone tells you that they are having chest pain, we have to take it seriously. Regardless. See, when someone tells us in the emergency or in any other place, I'm having like chest pains, oh my God, and I feel like numbness on this side of the chest, or some tingling on that arm, or that the arm just you feel like it's heavy, like you're carrying something heavy over there. Now the pain on your chest is not like when somebody hits you. No, it's not like that. And that's the reason why so many people ignore those pains. Because those pains is like you see pressure. It's not even pain. It's not like pulsations of like somebody pinches you. No, sometimes it's like this pressure, like someone is sitting on your chest. And if somebody's sitting in my chest, besides having this pressure, what else do I have? I cannot breathe. Shortness of breath, correct. That's basically, so those are the main symptoms that we're gonna take in consideration. So when a patient comes to you and says, I have a chest pain, don't just say, oh really? Oh well, no, let's call 911. No, more questions, you have to ask a little more. Because that can lead us to the big picture that might be really having a chest pain versus an stomach that is upset, okay? Or an ulcer, or gag reflex, some of those things. So we have to understand all these points. But for you, it's just to understand this. That's it. It's simple. They're gonna ask, what is the inherent rate of the pacemaker, the normal pacemaker, or the SA node? Because mostly we use SA node. The only time that we ask about the normal pacemaker is when you compare what is another name, what is sinus node known as. Oh, what is known as? The pacemaker. But other than that, they always gonna ask you, the answer is gonna be SA node, SA node, SA node. What is the function of the SA node? To initiate the electrical impulses of the heart. Remember, this is the one, this is the main battery. Here is the main source of electricity. From here, the electricity moves here, from here, moves here. And then come back again on a cycle.
Initiate what?
Electric pulse.
What is the function of the SA node or pacemaker? To initiate the electrical impulses of the heart. So they're going to ask you a question. Which of the following structures initiate the electrical impulses of the heart? And they put all of those over there. Well, which one will be? The SA node. If you don't see the SA node, what will be the other possible answer? Pacemaker, sinoatrial node. They spell it out instead of using just the first two letters of each word. The acronym that we call. So then you will say, you read the entire word. So get kind of familiar with these terms. Any questions? Can we move from there now? Let's talk about the graph paper. The graph paper is, I might say 90% of the time that they ask questions from here. So that means it's going to be on your test, right? So the graph paper. So when you see the graph paper that we're going to see now, and because we are now kind of close right here to the screen, you're going to see this. Some big square some lines that are, what type of line is this? Horizontal lines. And what lines are these? Vertical lines, right? So we're going to have horizontal lines and vertical lines. And you see that in between these vertical and horizontal lines, that what do we have?
Many boxes?
Correct. We have boxes. And inside these boxes, we're going to have more boxes. We're going to see it now. So that's basically what it is. So now, things that I want you to tell you is this horizontal lines measures time in seconds. Vertical lines measures voltage. That will be, well, in millimeters, right? So we're gonna kind of go over, because it's important that you know that the horizontal lines, particularly the horizontal lines, measures time, seconds. Because we're gonna measure the rhythm, the rate of an EKG with time. Here it is.
Oh, shit. Oh,
Can you go back?
Jesus.
Thank you.
Take
Zoom in.
Got scared?
Nah, I can't see.
I have a question.
You know, get them?
I have a question. You said
Sure.
the horizontal line
said
measures time in seconds and the vertical measures time as voltage?
No, not time. Measure voltage. That's like the amplitude, how tall the waves are going to be.
Thank you.
And that is in millimeters. Got it? Because later on, when we start calculating the heart rate, we're gonna measure every single little box, because we're gonna give them values, numbers and time. So then immediately said, oh, just counting the little boxes, now I know what is the time on that EKG. How long was the B wave? For how long the HF